Hi, everyone. I'm Charlotte Morm, and I'm the Knowledge Management and Learning Advisor on SPACE, which is the Social Protection Approaches to COVID-19 Expert Helpline funded by FCDO and GIZ, and which has organized this webinar. Courtney Cabot-Venton will explain a bit more about SPACE in a few minutes, but I just wanted to start by welcoming you all to this webinar on embedding localization in the COVID-19 response, which sits within socialprotection.org's social protection responses to COVID-19. Beyond the webinar series, this initiative also shares a weekly email and hosts an online community. And I know it's been an incredible source of collaboration and repository of knowledge for all of us working in different ways on shaping and delivering COVID-19 social protection responses. I thought I'd also take this opportunity to flag that socialprotection.org are hosting a global e-conference on turning the COVID-19 crisis into an opportunity. And that's taking place on the 5th, 6th, and 8th of October, and registration is now open for that. And with that, I'll hand over to our moderator, Kristen Smart. Kristen sits within Oxfam's global humanitarian team and leads Oxfam's work on cash and voucher assistance. Her current focus is on cash as a tool to strengthen local response systems, and Kristen co-leads a group on local partnerships under the Grand Bargain Cash workstream, and is a strong advocate for equitable and inclusive partnerships in CVA programs. So over to Kristen, thanks.
Very much, Charlotte, and welcome again, everyone, to this timely webinar that looks at linking conversations on localization, social protection, programming within the context of the COVID-19. I think we all recognize as a public health crisis, but is also a major socioeconomic crisis for the most vulnerable. So I'll go through the agenda just briefly. Someone could just flip to the next slide. We'll hear from 4 speakers, and we'll also have a closing from a discussant today. The format of the webinar will be that each of the speakers will share a short presentation, and others on the panel will have a chance to reflect on what they've heard. If we're speaking too quickly, or if you can't hear me or the others well, please do let us know in the Q&A chat box. So today, the first speaker we'll hear from is Courtney. She's going to present the program guidance that SPACE has recently released on this topic. Then we'll hear from Shiro and Maureen at Give Directly and Reach a Hand Uganda, respectively. We'll talk about some of their experiences working in this regard in Uganda directly. Then we will hear from Joe Powell from the Open Government Partnership, who will share their experiences on integrated strategies supporting civil society organizations and governments to work towards shared goals. All throughout this discussion, we will also hear from Michael Mulsmans, who will be supporting us with this topic. So let me introduce the panelists, and then I will hand over to Courtney. But before doing so, if we could go to the next slide, please. I don't seem to have my control function. I'll introduce the panelists. We have Courtney Cabot-Venton from SPACE. As you can see, she's a deputy team lead on the FCDO, which we're getting used to saying, I think all of us, and GIZ-funded SPACE initiative. She's a specialist in economics of sustainable development and has key areas of expertise in climate change adaptation, disaster risk reduction, water and sanitation and health, with a strong focus on economics, including the use of cost-benefit analysis and other economic tools for quantifying impact. Then we'll hear from, as I said, Shiro Wachira. Shiro is the senior manager at Give Directly. She's based in Nairobi, where she's been leading partnership development and recipient protection initiatives in Uganda as part of Give Directly's COVID cash response. She has over 5 years of experience in organization strategy, partnership development, community organizing, and engagement across East Africa and the US. Maureen and Dinda from Reach a Hand Uganda is going to be speaking to us with Shiro. Maureen is the Strategy and Business Development Manager at Reach a Hand Uganda, which is a non-governmental organization working on youth and sexual reproductive health and rights. She is tasked with the development of winning strategies that contribute to the growth and scale of programs, increase resources, mobilize and influence the future of Reach a Hand's partners ecosystem in a way that complements the overall vision of the organization. She is the direct liaison with Give Directly and the cash transfer programming as a response to the impact of COVID-19 in Uganda. We'll also hear from Joe Powell, who is from the Open Government Partnership, where he's the Deputy Chief Executive Officer. an organization itself which is reforms inside and outside of government, working to transform how government serves its citizens. He leads OGP's global engagements, including working with the steering committee, summits, and linking the open government partnership with other multilateral processes. So welcome to all of the speakers. And we also have a discussant today who is Michael Molsmans. And if we could go to the next slide, I think we also have one on Michael, with a picture of me. Michael is the head of the humanitarian division at Christian Aid in London. He's on the executive committee of Voice, on the coordination group of the Charter for Change, which many of you will probably be familiar with, on the UK Committee for the United Against Inhumanity, on the Operational Policy and Advocacy Group of the Interagency Standing Committee, Christian Aid's Sherpa to the Grand Bargain, and chair of ACT's Alliance Emergency Preparedness and Humanitarian Response Group. I was already introduced by Charlotte, so I won't introduce myself, but I will explain a little bit before we get started about the question and answer box. At the bottom of your screen, you have, I believe you'll have a small gray Q&A button. If you click on that, it'll open a series of question and answers, and you should be able to type a question in there. Throughout the presentation, I will be taking note of the questions asked. If you could please address your question, if it's to a specific speaker or panelist, or just put it in generally. Also, please, if you could note, if you're comfortable, or if you'd like to note where you're coming from, which organization or country, and we'll make sure to reference it accordingly. Any questions we don't get to in the question and answer, we will follow up on after the webinar. So please use that box. Also, just to mention, to interact with the socialprotection.org on Twitter, and there's some hashtags there for you if you feel like doing any live tweets. So I will hand over now to Courtney for the first presentation. Thank you.
Hi, everyone. Thank you so much for joining us today. I am, as Kristen mentioned, one of the deputy team leads on FCDO, formerly known as DFID's space team. I'm just going to give a brief presentation on what that is. We are an expert team supporting social protection and humanitarian response to COVID across both FCDO and GIZ's country offices. We also provide support to governments and other multi-bilateral partners. And we're intended as a multidisciplinary team that can help to address a whole range of questions relating to the response, providing support. We have been developing a whole range of knowledge products, and one of those products is a note that we wrote on localization and how to embed that in the response, and that is what's underpinning this presentation today. I'm just trying to, nope, I'm not able to, oh wait, I should be able to control the screen. There we go, sorry, okay. So what are we collectively trying to achieve? Routine social protection and humanitarian cash. We've seen a significant expansion of that support in COVID-19, both in terms of coverage, in terms of comprehensiveness, and in terms of adequacy. So a very extensive horizontal and vertical expansion of existing systems to address the needs under COVID. But one of the things that has come up repeatedly across country offices and other partners is that because of this rapid expansion to new populations, we are also needing to find new ways of working. So some of the people who are vulnerable to this crisis are not the same ones that we necessarily have built social protection systems for or responded to with humanitarian action. And so we are really trying to embed an approach that is more timely, more cost-effective, more predictable, ensuring accountability to local populations, and also prioritizing long-term sustainability and building systems for the future. So you can really see how across this, localization is a pretty dominant theme, particularly because of the extensive lockdowns and inability to move within some of the populations where our partners might normally move. In terms of COVID, as I mentioned, as we see this rapid horizontal scale out of the beneficiary base, We are also seeing a need to minimize exclusion errors, especially gender and social inclusion. So as we move cash and other social transfers into some of these new areas, how can we make sure that we are not excluding highly vulnerable groups? We're also needing to sensitize communities, minimizing potential risks related to transfers, again, particularly in some of these populations where there are new vulnerabilities, new people receiving transfers, differences in the transfer amounts. How do we engage communities to minimize risk? How do we respond to multidimensional needs, given that this, again, is impacting a whole variety of people? And particularly within a context where communities are inaccessible due to lockdowns or transmission risk, how can we engage with local actors, whether that's CBOs, local government counterparts, citizens, to be able to really embed some of these principles in the response? So I'm just going to walk you through some of the core recommendations that came out of the note that we wrote on localization. And then I think the way that we've structured today is we're really hoping that then Give Directly, Reach a Hand, and Open Government can start to contextualize some of that in terms of what that's actually looked like on the ground. So some of the core recommendations that we've put forward around engaging local actors in the response include a lot of the principles that we know already around localization. So things like devolving decision-making closest to the served communities by working alongside local organizations, and especially moving away from a design and consult model towards really a co-design and implement process. Engaging local networks for all communications, particularly in COVID-19. There's a real need for health messaging and also more work on GBV. And evidence is clear that drawing on trusted local individuals is absolutely critical in that kind of messaging. Also retaining local actors for a range of processes around targeting, identifying beneficiaries, designing appropriate payment mechanisms, thinking about what are the different layers in the sequencing of cash plus activities that can help populations, can really allow us to also be designing according more specifically to local context. And operating within the guidance offered by the core humanitarian standards to fight COVID-19, and specifically related to strengthening local capacities and participation. We've really articulated in the note as well that local actors need to be engaged throughout the phases of this crisis. As you all know, and we've all realized, this is not a bell-shaped crisis. This is an L-shaped curve that's going to require a strong response for years to come, not only around the immediate health consequences, but obviously the more significant impact to do with the lockdowns and the economic impact that has had on local economies. So we see that local actors play a key role not only in the cash or social transfers, whether those are humanitarian or social protection transfers, as I mentioned, ensuring inclusion, mitigating risks, layering information, but also helping with cash plus measures around providing direct services, particularly those that are needed more immediately related to health, violence, and protection, which are arising as key concerns, and also early recovery. So ongoing cash as required, layered with some of the types of activities that we know are going to be needed to help build back out of this crisis. We also, at SPACE, we work across a whole range of policy, program, and operational areas, looking at how to improve those and strengthen those in the response. And we see that local actors have a key role to play in all of these in different ways. So practical actions from a policy perspective, again, some of these will be things that we know from previous localization work pre-COVID-19, but these are things that have really been sort of had a spotlight shine on them as a result of COVID-19. So ensuring that financing includes budget for local actors, identifying entry points in legal and policy frameworks, actively engaging local actors, particularly in things like cash working groups and other governance and coordination structures where they often don't have a voice, investing in capacity strengthening. I think that's really key, because there's sort of a sense that if we push things out to local actors, that they can do that without any of the overhead costs that the international actors are charging. And it's really important that they are also receiving the capacity support to do that, particularly from a system strengthening perspective. On program design, really engaging them throughout the process on vulnerability assessments, targeting, transfer design. How do we think about whether cash is associated with conditionalities? How do we link with local actors to feed in real-time information so that we can adjust program design as things adjust, and particularly as lockdowns come and go in different communities? And in terms of delivery, we've really been working around this idea that I actually picked up from in Somalia, where they're not being able to access communities is kind of part of everyday life, where they work through networks of local trusted affiliates. These could be local government combined with CBO actors, with other local leaders, working through networks like community health workers, this kind of thing, who can really help with outreach, sensitization, last mile registration, ensuring that we minimize exclusion risks, all of these kinds of pieces that need to be addressed as we roll out through the phases of the crisis. And also just to emphasize that we really see local organizations, particularly those that have a gender and social inclusion focus to manage some of these risks, as being at the heart of the response, with a whole range of services. You know, as you'll hear from Maureen, they've specialized specifically around, they were already working on GBV, adolescent, SRH services. Others are doing education work. Some might be doing child protection work. So making sure to really draw on the key strengths of the local actors that we engage with. I'm not going to go through these slides in detail, but just to give you a sense, the localization note also breaks down some of the types of cash plus and early recovery considerations that might be relevant for different sectors throughout the response. So we talk about some of the ways that local organizations could be mobilized, for example, to disseminate health information, working through some of these big networks of community health worker programs to help with the response. And we go through that for a range of sectors that have come up as critical: GBV, child protection, livelihoods, education. So those are some of the very practical pieces of guidance that we've tried to embed in the notes, which you'll be able to access after the webinar. In terms of funding channels, I think this is also another area where we've been really trying to do some critical thinking, because as you all know, it's not very easy kind of building the bridge between different sources of funding and local actors for a whole variety of reasons. We do see that there's a critical need to provide technical assistance to national governments to embed localization work in their programming as part of their overall systems to ensure sustained engagement. This has been a big focus of SPACE, is looking at how to link and integrate humanitarian action and social protection systems. So building this into systems is key. Investing in platforms and intermediaries that can engage local actors to play a role, and then ensure that those coalitions have an active role in coordination and governance structures, as I was mentioning earlier. I think one thing that has particularly come out in COVID-19 is that those platforms and intermediaries really need to be able to address a whole range of needs. And a lot of the platforms that we currently have tend to be sector specific. Funding localization wraparound. So Give Directly and Reach a Hand Uganda are going to speak to this, where they used a localization wraparound to be able to really fully engage a coalition of local actors in the design and implementation of the response, and that's an ongoing process. So we're going to pause there before we move on to the Give Directly presentation, because I know that Kristen, I think, is going to guide us through a few discussion points just to kind of break up all the presentations.
Thanks very much, Courtney. It's interesting, some points you mentioned, they respond also to what was raised at a local local actor-led panel under the Grand Bargain Cash Workstream in this past July. So the points you've raised and the practical guidance, they match all the themes that seem to be coming out of this conversation, which really adds, I think, some backing to the importance and the relevance. I'll just hand over for a few minutes to Maureen first, and then Michael to reflect on this guidance in brief, if there's anything that you see around how localization is reflected in here that you want to highlight, or what might be missing. So first to Maureen, if you have just some points of reflection or thoughts.
Sure, thanks, Christine, and thanks, Courtney, for the presentation. When you were speaking, I kept trying to sort of like pinpoint some of your submissions to what we have seen here in Uganda, having worked with Give Directly to see how we localize the cash transfer program, particularly for COVID-19. And one of the things that for me has stood out is in terms of some of the core principles to guide localization. One being having that community awareness and how you bring local actors to the table to have an understanding of what the program itself is going to entail, who are the people that you're going to focus on, what are the issues that you're going to speak about, how does that transfer into some form of sustainable benefit for the communities that you're looking to address. So community awareness here in Uganda is a big issue, looking at ensuring that no room has been left for misinterpretation of what the localization efforts are. I think one of the aspects that we realized to be really important was in localization. I observed that you're tending to move quite fast in terms of the implementation. And so that brings an aspect of time, and particularly within the Ugandan context, we're heading into a political season. So by ensuring that there's community awareness and ensuring that at each step of the program implementation, that all of the actors that should have an awareness of what is happening do have that awareness, can go a long way in ensuring that there's clarity, such that there isn't misinterpretation that, or maybe the program is hinged on political activity and not necessarily benefits for specific target audiences. The other thing that I think was really important to speak on from your presentation is the comprehensiveness of localization, especially for communities, looking at are the people who are, and in this context, speaking on COVID-19, are the people who have been most affected by COVID-19 being reached. The uniqueness that COVID-19 has brought is that initially in our humanitarian work, we've been looking at audiences, for example, like refugee communities, of people looking at vulnerable groups of young people living with disabilities. However, with COVID-19, we saw an emerging audience that we hadn't initially anticipated, which was a lot of people that had places of work or that had jobs to go to on a daily basis, lost that. And now you're finding that within the context of humanitarian efforts, these are not your ideal or audiences that we are used to in the humanitarian programming, and now you find that they are at risk or they are impacted heavily by COVID-19. So the aspect of comprehensiveness, ensuring that there's gender and youth inclusion, ensuring that the audiences that are most affected are being sensitized, I think was something that was really big as well, that we have seen here in Uganda, but that I also thought was really, really key from your presentation.
Thanks, Maureen. It's interesting you highlight the time element and the need to have inclusion, because I think those often work against each other, you know, the need to respond in a timely fashion, but also horizontal expansion.
Yes.
All the inclusion needed. Thank you. Michael, would you like to add anything to that?
Thanks a lot. Yeah, no, Courtney, I think that's really great work that Space has been doing in producing this guidance note about localization. I think it's really useful and comprehensive, and thoughtful, and I think it hits a lot of important and good recommendations. I think it's really important to make sure that we co-create with local actors who understand the context and communities better, rather than designing and then consulting, like you say. I think it's really important to engage local actors better in coordination and governance. I think it's really important to invest in local actor capacity, especially in local women's groups. And I think local actors have a really important role in targeting, in identifying beneficiaries, in designing appropriate payment mechanisms. I think that COVID is a real opportunity for the international community to push localization forward, because international actors are, facing travel and access restrictions and hampered by permissions and lockdowns. But I think it's an opportunity that the international community hasn't done a great job so far of seizing. I think there's still quite a long way to go. I think COVID hasn't seen the practical implementation of advances in localization that we could have. I think that cash coordination mechanisms, still could do more to include local actors. I think oftentimes the funding given to local actors doesn't include the core costs that they need. And I think that overall, the amount of funding available for COVID in the international system, the amount of it that's actually reaching local actors, it's quite difficult to measure. So it's quite difficult to tell, because the figures are, difficult to come by. But those figures that do get articulated, including by Oxfam and NRC and the IASC, it looks pretty disappointing. So what I wonder is, I think that, you've got all the good recommendations there, but are they actually happening? Are powerful actors actually delivering on these recommendations? And if they aren't delivering on them, what is stopping them? And how can we kind of unblock the blockages and make this happen?
Yeah, not the easiest point to close that reflection on, but I know through the Grand Bargain as well, that's one area that you work on and I work on, to start to create some of that voice on space. But it's a good time to kind of ground the conversation in the field experiences. So we can hand over now to Cheryl and Maureen to talk a little bit of the work going on in Uganda and how that relates to both these pieces of advocacy and practical experience. I'll hand over
now. Thanks, Kristen, and thanks, Courtney, Maureen, and Michael for those reflections. So I will share a perspective from Give Directly, as has been introduced. And so what we're really bringing is both the INGO perspective, but also the perspective of cash implementers, who are really thinking about how Cash Plus and localization work in our emergency response, and really for the first time at the scales we're looking at. So I won't spend too much time on the Give Directly overall context, but just to ground what we do, we give unconditional cash transfers. Pre-COVID, we dispersed to over 170,000 households across Africa. Our COVID response across Africa has reached 270 plus thousand individuals. So we're really scaling quite quickly. As Courtney mentioned, cash has emerged as one of the key pillars of COVID response globally. Diving into some of the work we're doing in Uganda. So we've been working in Uganda since 2013, prior to COVID, primarily with refugees and host families. We'd served 50,000 households prior to COVID. We've reached 20,000 individuals as part of our COVID response, primarily funded by USAID and other institutional funders. And we're working across 7 municipalities in Uganda. Just as a quick piece of context here, our operations in Uganda currently are paused, so I'll integrate that context into my presentation. As I move into the COVID project snapshot, I've shared a statement from our organization on that, if anyone is curious. Cool, so I know I breezed through that. If there are any questions about how Give Directly operates in general, please do put them in the Q&A box and we'll address them down the road. But I really want to spend time focusing on how we've adapted to COVID and how we've thought about the role of local actors in partnership with Courtney, who's been a really trusted advisor on this work, and organizations on the ground like Reach a Hand. We've been working closely with those partners to design our response. So first, to contextualize everything we're doing in Uganda, About 80% of our COVID response is anchored in a targeting approach we're using in partnership with mobile network providers. So what we're doing here is we developed a model to identify vulnerable parishes. So that's a sub-municipal administrative unit. The parishes we're targeting typically have a population of 3,000 to 5,000 people. And then once we identify these parishes, we work with the two largest mobile network providers in Uganda, who account for about 90% of mobile subscriptions, to send out blast consent messages to all the subscribers within those parishes. Prior to our pause, we sent messages in 63 different parishes. This approach carries exclusion risks. And one of the key things that we realized really early on is we want to work with local actors to minimize these exclusion risks. So that's where our CBO and NGO partnerships have come in. And we're doing a few different things with CBO and NGO partners. Primarily, we're sourcing lists. So identifying organizations working in our target areas and asking them share their beneficiaries lists with us once we get consent from those recipients, and then reaching out to enroll eligible recipients. So I'm just going to quickly go over the stages of our model and speak over some opportunities we've seen to pull in local actors in a much more comprehensive way. And I won't spend a ton of time going in detail along each of these pillars, but just highlighting some key points. So typically we start with a community and recipient sensitization piece. Maureen spoke to the importance of that in her response to Courtney's reflections. And here, there's an arm that's more independent, where GiveDirectly has stationed city liaisons who are our staff members working with municipal, district, and parish and sub-parish level leadership to raise awareness about our program. But we're also relying on local partners through CBO networks and NGO networks to sensitize their beneficiaries, one. And two, what we're hoping to do is launch an ambassador network where a partner like Reach a Hand would identify a certain number of field volunteers or field staff that are working on their programs, who could be trained on key principles. So we're looking at messaging around our cash program. We're also looking at mitigation of COVID-19 community spread. We're looking at GBV modules, and have those people really embedded within the community, raising awareness about the cash targeting that's happening in those communities. And we also see a role for ambassador networks in our follow-up and internal audit structures. We have extensive survey mechanisms internally, but we want to really complement that with feedback from field actors who aren't necessarily in our reporting channel, but really do have an opportunity to get that organic feedback from community. So where I really am excited to engage this group is on some of the lessons we've learned on some of the operational challenges of implementing cash in this way. So both the mobile network targeting approach and our CBO partnership approach are new models for us, and certainly new at this scale. And so we're really learning as we're sort of like driving as we pave the road. And so some of the key takeaways for us, one, there's sort of a key point around list quality and what to look for in a list when we're sourcing partnerships. We've seen sort of polls of difference in the types of partners we could engage. So on the one hand, we have INGOs who are working in these areas that we had previously not been working in. And those partners are much more likely to have very large, complete data sets, but maybe a little bit less likely to have regular touch points with the people on those lists. And so we run into challenges like we reach out to someone from that list and they're like, I don't know that organization. I don't remember when I worked with them. And then on the other hand, we have much more grassroots embedded CBO networks who are really in community every day, but might not have that capacity to store a lot of beneficiary data, which makes those partnerships not very scalable for us when we're looking at 6-month implementations of emergency cash. Related, but a slightly separate point, just thinking about the operational challenges and risks and barriers that come with operating at the sort of scale we're operating at. we found that some of our smaller partners are less able to weather the operational risks that come with sort of like running programs at this size. And something that we're externally reflecting on is how do we protect our smaller partners from some of the shocks that come with, for instance, being asked to pause operations for a while, which our larger partners are usually able to better absorb. Another point of reflection internally has been about the different roles that actors can play and whether each actor needs to be involved in each stage, and what high quality engagement looks like if we're having people engage at different stages. So Courtney talked about program design and program delivery, and we're thinking about how can we have local partners really inform how we target and sensitize communities, even if not all of those partners will provide lists and not all of those partners will provide ambassadors, and just mix and match to meet capacity at different stages. And then finally, which Michael touched on, we're thinking a lot about how we share risk and not just transfer risk from ourselves to local partners, and how we flow down funding, particularly when we're looking at these institutional agreements. Can we either write into grant funding that we want to be able to pay our CBO partners, and not just for program costs, but for some of those non-program attributable costs, and really share that burden of labor, as our CBO partners are often bearing a lot more frontline risk, both in terms of operations, but in terms of reputation as well. I won't go over the looking ahead piece in a lot of detail, just because I'm sort of conscious of time. But I do just want to sort of contextualize this more broadly in GiveDirectly's COVID cash response across the region. So across Africa, we've seen different levels of engagement with CBO networks, and we've taken a lot of different learnings from our various country operations. So in Kenya, where I sit, we've enrolled a much larger number of recipients from CBO lists, and learned a little bit more about, some of the partners we're working with are very, very large. So there's a great beneficiary list source, but we're not able to reach everyone on their list. And what risks does that create? And how do we make sure that when we engage partners and they sign up to be part of this program, they are really well informed about our model and the risks that are associated with cash delivery, and are really providing informed consent. In Malawi, we're looking at ways to outsource some of this capacity building work that we're realizing we just don't have the expertise or capacity to do too much of internally. So we're thinking about structuring a funding opportunity that embeds technical assistance from an external partner. And in Uganda, we've been working with Courtney and Reach a Hand, as well as other partners, to think about localization wraparound strategies, including the ambassador network I mentioned, including really embedding local government network engagement in our operational plan, and driving a culture of safeguarding through all our partnerships work. So I'll pause there and hopefully continue this discussion and these reflections through Q&A, but I'll hand it back to Christine, or over to Maureen. I'll let Christine facilitate that.
Yes, just straight to Maureen. Hey, Maureen.
Sure, I'll just quickly get access. Okay, yeah, there we go. So I'm going to, for the most part, speak on the experience that we have had as Reach a Hand, working with GiveDirectly on localizing the cash transfer program. But I'll quickly share an overview of who we are as Reach a Hand. We're a non-profit, non-government organization that is founded and based here in Uganda, working on youth sexual reproductive health and rights programming. So from HIV and AIDS, modern contraception, behavioral change, livelihoods and skill development. Our target audiences double between urban and rural communities, where our entry into communities is with a peer-to-peer model. And our priority is on information dissemination that results into improved access and strengthening of the health service value chain through traceable referral linkages. We are in all of the regions of Uganda, including Moroto and Mbarara as focus districts that we're working on with Give Directly for this localization efforts. I put a small map there to sort of like show our footprint in the country. Yes, so within the localization of the cash response program, ours was to really bring the understanding of what is on ground with the communities, because we work directly with a lot of the target communities that Give Directly space and Shared Trust were looking at the time of the co-design workshop that we participated in. So looking at target beneficiaries that had been heavily affected by COVID-19. And earlier on, when I was giving my reflection on Courtney's presentation, I did speak about the aspect of comprehensiveness and ensuring the inclusion of different kinds of vulnerable groups. So looking at inclusion when it comes to young people, inclusion on a gender spectrum, and looking at sort of like marginalized communities and groups, because we work with these on a day-to-day basis. That experience, I think, really gave a lot of value to the entire localization process, because then we were able to go back and forth in terms of who are these target beneficiaries, where are they, what are they doing, how can we reach them. When it comes to the actual cash response program and cash transfer, what are the alternatives that we have when it comes to transferring money? How can they get it? Do we have their data? And really just asking questions around who these people are and where it is that we can find them. Fast forward from the co-design process, we collaborated with Give Directly to identify beneficiaries. So I've shown you the map where we are working in quite a number of areas within Uganda and have interventions with different beneficiaries at the grassroots. And during this process, we were just really going back to our database and looking at names, age, phone contacts, location of people that we had defined as being directly suited for the cash response program, right? And one of the experiences with this has been the realization that a lot of our beneficiaries are, in terms of data collection, there's such huge gaps when it comes to information around where they are. Many of them are very nomadic. So for example, we do work with refugee audiences. Many of them are nomadic. So from time to time, maybe they're in a settlement, and then before you know it, they've moved back to either South Sudan or DRC or Burundi, depending on which country it is that they come from. And so in looking at this data and trying to cross-check whether this data is still valid from when we collected it, getting consent from a lot of the beneficiaries, a lot of that information came to light. And so having that experience in terms of data and how you maintain it, and up to a certain point, can it be relevant for a program that is as swift as the cash response program? That was such a huge insight for us. We participated as well in the communication to beneficiaries. In earlier discussions, we have spoken about community awareness and the need to have all of the relevant local actors understanding what are we doing, for whose benefit is this intervention, how are we going to reach them, how do we know that your intervention is legitimate and you're not trying to fleece us. There's such an understanding here in Uganda that anything that has to do with money, you're trying to buy me, quote unquote, right? So ensuring that there's that community awareness throughout all of the relevant local actors to make sure that there's that understanding of what the intention of the program was, who the direct beneficiaries were, how we continue to communicate with them for them to understand that this is not a scam, no one's trying to fleece you, this is legitimate, and you can be able to benefit from it. We communicated with our beneficiaries through following up via phone calls, so sitting down and directly calling them, through text messaging, but also that was reinforced through Give Directly's systems, where they were sending out messages as well to a lot of the contacts that had been identified. And then we're looking at doing ambassador activities, where there's that continued awareness at community level with our ground volunteers and the people that we work with on a day-to-day basis at community level, to continue to reinforce the aims of the program, what it is intended to do, who the beneficiaries are, sort of identify some of the risks that might come up at community level, and quickly communicate those for swift action. I have spoken a little bit about some of the benefits. Many of them were positive. However, we did also experience a couple of challenges when it came to rolling out and actually executing. And I thought that, I think from Courtney's presentation in terms of some of the reflections, I was listening in and I was noting, oh, this is something that I think is relevant for us as well, because we did experience a couple of challenges that we had in foreseen at the beginning of the program. I do think that the co-design inclusion of different partners was really, really helpful in, one, just understanding the broad perspective of the context and the environment that we're in, right? So who are the audience members? Where are they? What are some of the risks that we can anticipate? Whose permission do we need to seek? Who has power in the community? Who can negatively influence the program? And sort of like understanding what the divergent beneficiary needs are for different audiences that we are looking at. The other thing that I think worked out well is the swiftness within which we moved from the core design and then into engaging with different partners, because one of the things that I think COVID-19 has really magnified is things are moving really quickly. So one day it's we're limiting movement of public transportation, then the next day it's like there's lockdown for the entire country, stay in your homes. Then before you know that, you can't access even, you know, like the most basic of transportation to get to a health facility. So the swiftness within which the program was rolled out worked very well in terms of matching the urgency of the impact of COVID-19, because people quickly lost jobs, people quickly lost their sources of livelihoods. And for us to be able to move to that point quickly, I think was such a strong aspect of localizing the program on ground. When it came to the aspect of data absorption, and Shiro might have touched a little bit about this, one of the big challenges has largely been in cleaning a lot of the data and sort of like ensuring that the people that we're trying to target from this data are actually people who have consented, people who are in the areas that we're trying to target, and people that can sort of like speak back to us. So a lot of, for example, phone numbers that were called were not on, and for one or more reasons, could be structural challenges, electricity, people in rural areas do not as often charge their phones, maybe phone numbers were lost and now they haven't been replaced yet. So just a lot of structural challenges that have affected the data absorption and enrollment of individuals into the system. So that has caused quite a bit of challenge, especially with the beneficiaries that we had identified initially, because in engaging with them quickly on, we anticipated that with the same swiftness that the program has rolled out, that's the same energy that we're going to carry on throughout, quickly seeing how COVID-19 has been moving and the effects have been felt with such, you know, a quick turnaround time. That being said, the challenges within the challenges from communicating what the message is, what the intention of the program is, and actually executing on it has taken quite longer than had been anticipated. And this has caused a bit of frustration within some of the beneficiaries because, you know, and it's become unavoidable for us to sort of like walk around the challenges on, were you guys for real? Were you, you know, you told us this was legitimate. You told us this wasn't a scam. However, you know, the cash transfer program, as it should have rolled out, is not rolling out. Getting questions from local leaders who had initially endorsed and signed off on the program, asking questions. And so that delay in the process and the program has been such a huge challenge that we hadn't anticipated before. And I think in terms of reflections and some of the things that we might need to consider and think through is that piece on that continuous engagement with local actors such that they fully understand the process from get-go to how it is proceeding. If there are any impediments in the road, that being very clearly and effectively communicated such that there isn't opportunity or there isn't room for them to think otherwise. I might have mentioned earlier on, Uganda particularly, we're getting into a political season, almost getting into peak campaigning and election season. We're having national elections early next year. And so each and everything that is being done at community level can easily be mistaken or assumed to have a political motive behind it. So that gap and that challenge we had not anticipated. And then for us, really, the lessons that we're learning and we continue to learn from this whole experience is the need to align the messages for the beneficiaries, leadership with their expectations to avoid that misinterpretation, right? And then obviously matching, you know, standard organizational financial processes. If looking at the target audiences and communities that had been identified, most of these are unbanked people. They don't have a bank account, they don't have a mobile money account. They just hold physical cash. If they have to transact, they do that with physical cash. And sort of like trying to draw a balance between the audience that needs, whose needs are going to be met by the program the most, versus maintaining standard organizational processes to avoid things like money getting lost, you know, in the process, or money being stolen, or fraud, those risks, and trying to balance up what is on ground versus what the program's fundamental processes are, is something that we're still trying to learn from and looking at what other alternatives could there be to ensure that localization matches what is actually on ground. And of course, that ties into the point on disbursement of funds in a way that can be sustainable. The primary function of the quick cash transfer program is to meet those immediate needs for a lot of people. And again, I think this goes back to Courtney's presentation on adequacy in terms of, you know, is this sufficient or is this covering those needs that, you know, the target audience has in this moment. That being said, for us, in our experience, trying to look at it from a sustainability lens, how can we support these target audiences or the identified beneficiaries to sort of like use the program for it to be sustainable for them in the long haul, bringing in issues on financial literacy, tying in aspects on livelihoods, looking at components on how, in spite of being participating in the program, can prevent aspects on like gender-based violence and the issues that come with talking about and dealing with money in different kinds of settings, especially at household levels. And then, of course, the challenges that we have experienced with the data. Shiro can attest to this. We've had quite a number of back and forth conversations on a lot of the data because it cannot be maybe absorbed, or some of the audiences that we thought could be enrolled might not be able to be enrolled because they don't have phone numbers. But yet we know that these are people who actually would definitely benefit from the response. So a lot more lessons to learn and reflect on, but these are some of the key ones that really stood out for us. Thank you.
Thanks very much, Maureen. It's nice that you were able to highlight the presentation, the kind of contextual dynamics come out more, I think, and particularly in partnership with local actors, how you can work almost in real time to address some of those, or at least recognize them. But that also, I think, relates to your risk point. You know, you are the community-facing staff, you're close to the community. Those challenges also directly correlate with. So I'll hand over to Michael to reflect on this as well, and then speak to Joe about open government partnerships. Over to you, Michael.
Okay, no, thanks. That's really, thanks a lot, Shiro and Maureen. As Christian said, it's really instructive and valuable to get that kind of perspective on you know, the actual operational challenges that you're encountering in Uganda. I think Uganda is one of the kind of leading countries for pioneering efforts on localization. I think the Give Directly business model is really interesting and valuable, and I think it's really interesting to gain from the lessons and learnings that you have from that. I think three interesting issues that you described were like the challenge between the easiness of investing in big fat national NGOs that have all the kind of Western style systems in place, which tick all the boxes, versus the desire to get to the kind of real grassroots local NGOs that actually are close to the communities, to the communities they serve, and have the real sort of contextual understanding of how to reach the most vulnerable people, and the real importance of doing our best to invest in the non-core costs of local actors so that they can run sustainable businesses, and the importance of risk sharing. And and then I think when Maureen spoke, it was she brought across really clearly the comparative advantages that local actors can bring to this agenda with their kind of unique ability to be able to identify who the most vulnerable people that need the assistance are, and to understand the context and the culture. And it was really good that both Shiro and Maureen were really sort of open about the challenges and you know, realities and operational difficulties that they encounter, because that helps us to kind of think about and learn from how we can move forward. I think just to say, like a similar, I mean, I think we have kind of similar experiences and challenges in Christian Aid, where I work. We're working on these survivor and community-led response approaches with ACT Alliance and Dan Church Aid and Church of Sweden, and many local partners in Philippines, Myanmar, Kenya, Gaza, Palestine, and Haiti. And we're trying to put local populations affected by crisis in charge of their own response and recovery by giving them community micro cash grants in order for them to design and deliver their own interventions rather than something thought up or implemented by us. And I think it kind of holds similar advantages and lessons to what Give Directly was describing, and we found that it enables communities to obtain what they need quicker and at lower cost than working via external actors, and you know, represents an explicit transfer of power and builds genuine local ownership, and helps to promote psychosocial recovery. So I think, like, there is another sort of tool in the aid community's toolbox, like survivor and community-led response. And I think the Give Directly model is another really interesting model with some similar features and some different features. And I think that we might kind of, you know, over time learn from each other from the two approaches.
Thanks, Michael. And it's interesting, some of those concepts that were originally more on the development sector side, like microfinance and things, are now coming in through these community cash grants, and it's emerging area that I think does lead the agenda. So I'll hand over to Joe now for our last presentation, and we'll open for question, reflection, and question and answer. So Joe, over to you.
Hello?
Yep, we can hear you clearly and see you well.
Okay. Thanks very much, Kristen, and thanks for the invitation to be here. As a very brief introduction, the Open Government Partnership was founded by 8 heads of state and 9 civil society leaders in 2011, spearheaded by then President Obama. And we now have 78 member countries who join by meeting basic eligibility criteria of access to information, open budgets, asset disclosure, and civic space for citizens and civil society. And at the heart of OGP is actually this issue that the previous presenters were talking about, which is locally owned co-creation or co-design. So all of our members have fora where civil society and reformers in government meet together to work out how open government approaches can tackle context-specific challenges in their country. And since OGP was founded, there have now been over 4,000 of these reform commitments that have been made, many having a major impact in improving governance, public service reform, anti-corruption, access to information, and so on. So you're probably wondering kind of why are we here? We're certainly not experts in social protection, but we do believe that our model has something interesting to offer this community, especially in the pandemic context that we're in. Since April, we've been running a campaign called Open Response, Open Recovery. And the idea behind that campaign is to show how open government approaches, by which I mean transparency, accountability, public participation, and inclusion, so how those values can support effective pandemic management. And of course, I think all of us will have seen many examples of where closed government and lack of transparency and lack of public participation has affected the response to COVID, from the procurement of PPE, of medical equipment. We've all seen how those contracts have gone wrong when they've been rushed, when they've gone to companies that are politically connected, when they haven't been done in the open. Similarly, people have mentioned in previous presentations the challenges of open and reliable data. Clearly, that's been a huge factor in effective response to the pandemic, and also protecting the space for civil society to operate, and protecting basic freedoms of the press, of assembly, of speech, and so on. Of course, now one of the big issues that many countries are facing, including, I assume, many of the people on this call, is how we ensure that these massive stimulus packages, including big expansions of the safety net, are rolled out effectively, and how they reach the people that most need help. And our learning from almost 10 years in the Open Government Partnership is what is most effective is an integrated strategy with layers of civil society and reformers in government and international partners working together towards the same goal, but in a spirit of co-creation and co-design. So I'm just going to share a few examples that I thought may be relevant to this group, of where we've seen these open government approaches applied to cash transfers and safety net programs. So one type of example, and I think we've talked already a little bit about this, is empowering grassroots civil society to actually follow the money, to work with vulnerable communities, to expand information about programs, to combat disinformation. One of the classic examples from our community, the open government community, is in MKSS, which is a very famous Indian social movement, which for decades now has used the right to information and community audits of spending to make sure that the Rural Employment Guarantee Scheme in India, in Rajasthan in specifically, actually paid the villages that it says it has, and that the projects it was advertising as completed were actually completed. So they were closing the feedback loop, if you like, from the grassroots with a central program. Another type of example we've seen in OGP is more the kind of capital-based professional elite civil society. So to give an example, Funda in Mexico is a civil society organization that, through a series of spending audits, and budget transparency initiatives, working with rural partners, was able to show that one of Mexico's big nutritional subsidy programs was not actually reaching the rural communities that were most in need of help, and actually was exacerbating food inequality in some cases, including leakages to drug traffickers and major landlords and so on. So this was a kind of a research and analysis project from a national civil society organization that was able to increase accountability in a safety net program. And the examples that we think are perhaps the most interesting is actually when those two first ones I mentioned are combined. So I think one of the speakers mentioned the Philippines. In the Philippines, the Central Budget Office in Manila made local school materials and road construction transparent, and in turn, local civil society organizations were able to audit schools to see whether textbooks ever arrived or roads had ever been constructed. So this was an exercise that complemented the national audit institutions with citizen investigations and kind of citizen social audits. So just to simplify, and I guess the lesson that we would be invited to share really is that having civil society involved is fantastic, and for all the reasons people have mentioned, but having civil society that actually work with reformers in government, with formal accountability institutions, even with parliaments as well, that is a really sustainable model for improving governance of safety net and cash transfer programs in the long run and building local ownership. So how would this apply right now? The final example I wanted to share is a live practical example from Nigeria, which is one of OGP's steering committee members, so one of our bosses, if you like. Nigeria has approximately 3 trillion naira stimulus package, which includes a goal of expanding the safety net to 30 to 60 million additional vulnerable households, job protection for people working in SMEs, employment projects in rural roads and infrastructure. And so obviously this is a major test of the government's capacity to expand the safety net at a crucial time when the vulnerable population has expanded. In July, the Open Government Partnership Forum in Nigeria, which is chaired by the Minister of Budgets, but also includes the Auditor General, officials from different government departments, many civil society organizations, the country director of the World Bank, DFID, and other donors were all present. And one of the issues that civil society directly raised in that meeting was around the cash transfer expansion. And the types of issues that were raised are many that Courtney introduced right at the beginning. So the role of audit function and ensuring that money was spent well, the accessibility of the register and how the government's target of adding 1 million new poor and vulnerable households was being implemented, what data was being used to do that, the role of biometrics and unique identifiers, which the World Bank has been supporting in Nigeria, communications, including how the expansion was being communicated to the communities that were intended to benefit. Civil society brought up previous examples of failed cash transfer schemes, including one to support rural women farmers, and a long discussion about the role of social accountability in the form of citizen feedback, social audits, and so on, many of the things I've just mentioned. As a result of that meeting, Nigeria will now be adding a commitment to us, so to the Open Government Partnership, on the civil society engagement and citizen engagement dimensions of their COVID safety net expansion. So this is just a live example, a practical example to show people on this call how the open government community could really support your work. If your country is an OGP member, we would be delighted to talk in more detail about how this might be an opportunity for some of you. But I'll just, I guess, close by saying that we really do see the value of joining the community in this call and some of the open government reformers we work with, because we really do see the power of those core open government values helping to implement a more inclusive and effective expansion of cash transfers at such a critical time. And with that, let me hand back to Kristen.
Thank you, Joe. I think it was good timing to add this social accountability and the role that civil society organizations can potentially play as kind of independent groups that may be able to hold institutions to account more sustainably. It's a really good addition to the conversation. So thank you. I will hand over to Courtney briefly to follow up with some reflections, and then we'll go to Q&A. Thank you. Over to you, Courtney.
Great, thank you. I will be very quick because we are keen to dig into Q&A. But I just want to say thank you to the panelists, because you really have highlighted what I was hoping that we could highlight, which was kind of taking a view right across the spectrum from a very practical, very localized example in Uganda right through to what does that mean for systems. And I think one of the things that we've really been trying to unpack at FCDO with this note and other work is, what does this actually look like in practice, and what are some of the blockages, and how do we address them? And I think, you know, Maureen's points on kind of the risks and credibility to local organizations is so unbelievably critical. And we really, with that partnership with GiveDirectly, wanted to unpack what does this actually mean? And I think it really reinforces the point that investing in capacity of local actors, investing in their safety and their risk management is absolutely critical. Shortchanging that is dangerous and inappropriate, and we really need to make sure that we're maintaining that focus. I think also one of the other things that really came out from that localization wraparound in Uganda was we were very pleasantly surprised by how many local actors we were able to pull together into a coalition that actually allowed us to operate at scale, which was kind of one of the pushbacks that we frequently get around whether localization could work. And really to the point, you know, GiveDirectly is not an anomaly in terms of the long delay on the cash transfers arriving. One of the big themes that we've been really pushing on within FCDO and Space is around timeliness and quality of the transfers. And really the local actors are the ones who are delivering cash in April, while the rest of the community has frustratingly lagged, which is a recurring theme, as we all know. And that has been a real lesson learned. And I would almost argue that some of the risks that we associate with working through local actors, I'm an economist, so I always think in costs and benefits, that the benefits of being able to have a timely and responsive cash delivery would far outweigh some of the risks that might be there. So I'm hoping we can kind of debunk some of these myths. And then just to link that through to Joe's presentation, which was so helpful, we also were really then thinking, well, what does that mean from a systems perspective? Because we're really trying to build integrated social protection and humanitarian systems that can be shock responsive, that can address needs as they arise. And I think that is where the work that OGP does is so compelling, because it really does formalize this relationship between local actors, between coalitions of CBOs and other civil society engagement, in a very active forum with reformers within government, which is absolutely critical if we want this to be part of the overall system. And I think we're really seeing that this needs to be a systemic approach, that local actors must not be an afterthought. They must be integrated from the start with all that we do. So I hope that has equally been interesting to all those participating, and I'll hand over to Kristen to lead us through some of the questions that have been coming up.
Thanks very much, Courtney. I will leave my video off because I heard I'm breaking up, but if someone could flag if the voice isn't working well, that would be helpful. So thank you all very much for your presentations. Just to mention that the question and answers have been responded to as we've been going along, so please have a look while we're going through the Q&A session, also the answers section of the chat box, because I think there's some interesting questions there that we might not get time to today. But I've pulled a few out, just one per speaker or panelist, and also for Michael as a discussant for us to focus on. So I will start maybe with Shiro, if that's okay. Shiro, there was one question from Barbara, which I think you will have dealt with, or at least thought a lot about in the work that GiveDirectly does across East Africa and elsewhere. Is this kind of perception or danger that, you know, humanitarian actors create a parallel system to public systems and how that balances out over time? And the question Barbara was asking is specifically in the risks of introducing these parallel systems again. Over to you.
Yeah, thanks for that, Kristen. And Barbara, it's a really, really great question. And it's something that we've spent a lot of time thinking about internally, and I think our organization response continues to evolve and mature around how we engage local government. Across our programs, we're really keen to work closely with government and co-implement, either as co-implementers or as key stakeholders, partners, advisors, or champions for our project. And the role government plays really depends on the different contexts that we're implementing in. But effective government relations really are critical to a successful implementation process. So zooming in on Uganda, our cash program is 3 months. Our emergency COVID cash program is 3 months and $80 total over those 3 months. So how we've approached it is we involved the Ministry of Local Government, as well as the Ministry of Metropolitan Affairs at the very beginning, together with our funding partners in developing our targeting approach. And we've involved district and local leader engagements in thinking about the sensitization and implementation, as well as identifying potential partners that we put through our vetting process. In other projects, for instance, our refugee work, we're working much closer with various institutions to make sure that our cash program is embedded within a wider range of service delivery. And so it's something that we continue to think about, and the specific role of government will change based on the demands of that particular program. But yes, it's really crucial. The government is playing a central role, and the government is bought in. There's still a lot of cash skepticism across East Africa. And the answer to combating that is definitely not getting a bunch of donors in the room, a bunch of international organizations in the room, and beating the drum for cash. It's sort of a process of this co-advising, this like stakeholder and champion building that we're continuing to embed within our programs.
Thanks very much, Shiro. I think it was a good explanation, or at least a talk through the importance of it. Maybe we can go to you, Maureen, with a question from Richard, and also I think a question that's linked from Vandras. So Richard's question is about how, especially in the context of COVID-19, you've been able to work to sensitize local communities. And I think that does relate to another question around how do we involve local actors and communities in a meaningful way versus the need to also respond quite quickly and kind of time constraints versus needs that we face. So over to you, Maureen.
Thank you, Kristen. So the question of engaging local actors and beneficiaries from the viewpoint of creating awareness about the program, we largely used just really the telecom channels. So a lot of phone calls were made to so many people, and a lot of text messages have been going out, and a lot of follow-up text messages have been going out to the beneficiaries that we had identified. We've been doing this. GiveDirectly has also been doing it with the beneficiaries that they have absorbed in the process and in the system. So we've really been having that synced back and forth via the different mobile alternatives that we have, trying to make sure that we are adhering to the standard operating procedures that we have in line with COVID-19. We do have plans of supporting our different ambassadors on ground to continue to do sensitization and awareness activities. However, now that the country is no longer under lockdown and people can slowly, are slowly getting back to movement and day-to-day activities. For us now, it's really about adhering to the operating procedures. Do our people on ground have PPE? Are they protected? Are we supporting them to get tested frequently in the communities that they are, engaging, and the people that they're speaking to? Are we making sure that the basic standards are being adhered to? So for us, that's really calling for a lot of retraining, particularly on COVID-19. But so far, those are some of the ways that we have been going about that. And then on the point on, Richard had asked a question on how do we try to speak on authenticity of the program, and now that we've had this lag and this delay, especially with the cash transfer itself, that's a challenge that we are still working with. We're trying to see how to go about it with Give Directly, and again, for us, it's really trying to put out as many messages to keep our beneficiaries aware of what's happening, what's the next step, what are we working on, but also working very closely with the local leadership. So maybe just for quick context, in Uganda, you cannot work in a community if you haven't had sign off from your local leader. So that could be at the district level. That's our structure. At the district level, you have to have a sign off, you have to have an MOU such that the districts are aware of your intervention. So at that level, we're trying to also ensure that we can bring them up to speed with some of the delays that we have encountered and what our mitigation plan is for some of these delays, such that they can help us in continuing to reinforce the message that we have with the beneficiaries on the authenticity of the program, and for them to understand that this is actually something that is definitely going to happen. Yeah.
Thank you, Maureen. I think also this might lead well to one, Courtney, that you had as well around, from my experience anyway, part of the issue with cash programming is the graduation model and how we communicate that at a local level, and the reality of phasing out humanitarian response in comparison to longer term public led responses. And there was a question from Lily and Courtney, I was wondering if you could respond to, around how can we evaluate these graduation models for unconditional cash transfer programs, which assume that those receiving the cash transfer programs will either graduate into a public-led social protection scheme or a livelihood scheme or another form of assistance, and sort of graduate out of the humanitarian cash transfer part. So yeah, your thoughts on that one?
Yeah, sure. I mean, I think how to evaluate graduation is probably the topic of another very in-depth webinar, but certainly from the perspective of this webinar, sort of how to engage local actors in that, I think, one of the things that I highlighted in the FCDO localization note is around the need for Cash Plus, for also sequencing and layering different approaches. And so what we've been sort of thinking of graduation in an alternative fashion, in terms of how can we learn from the evidence, that the strong evidence on graduation having a positive approach due to the sequencing and layering of different types of interventions. What does that look like if you adjust it for COVID, if you adjust it for informal workers in urban areas who are the ones who are most deeply affected? How do you think about what those layers would be? And I think that that's where, the work in Uganda, for example, was really the start of a process to engage a local coalition, not only on Give Directly's cash response, but to also embed them in the wider process as we move forward around action planning and thinking through what those sequences and layers are. And I don't think anyone thinks that that's not needed, but it's what is going to work, what's going to deliver the best value for money, and how do we adjust that? And that's where localization really, again, comes forward as so critically important, because it allows a more tailored and nuanced approach based on the specific needs of communities and different groups that are affected under this crisis.
Thank you, Courtney. And I guess I have one that is sort of the humanitarian localization side and the social accountability and the sustainable role for civil society actors. Word for you, Joe. As you know, I come from Oxfam and I work in. I was wondering if you had some suggestions on how actors on the humanitarian side can support civil society organizations to start to build those capacities that are needed, or strengthen or support capacities that would allow them to work or facilitate their work around social accountability moving forward. Now we engage organization through humanitarian cash transfers, but if we could support a foundation for that longer term social aspect to add to our ways of working. Over to you.
Thanks, Kristen. Obviously, I think this is the challenge that I've been hearing for the last hour and a half or so is you know, there's the speed, if you like, the speed of the emergency, the need to respond quickly, and then sometimes I guess some of the inclusion and kind of partnership dimensions can be kind of skated over or missed, and I guess that my only recommendation, and again not coming from any expertise in this field at all, is that in almost all of the countries who are members of OGP, there are fantastic organizations who are working on the follow the money agenda, so tracking government spending on infrastructure, on public services. There's great campaigns on tax, like on profiling where revenues are coming from. There are really good campaigns on social audits, as we've discussed. And all of those are tools that seem to me could be very relevant to this sector. So perhaps just the simple first step is to open a dialogue with some of those national and local civil society organizations who have been working on social accountability in different fields, and just open up that dialogue to see where some of the learning might be. And I'm sure that is already happening. This is not, I'm sure it's happening in many places, but I would be curious just to see if we could facilitate a stronger kind of learning between those two communities.
Thank you, Joe. That actually makes a lot of sense. The need to kind of understand what exists in terms of networks, which are kind of informal sometimes at that local or national level between the civil society organizations. We don't often account for that, you know, in terms of time for humanitarian response. So I appreciate that, and I can take it forward, at least on my side. Michael, if it's okay, I'll hand over to you with a question, which I think well placed to respond to from Kate, and then also leave you the floor for a closing and a summary. Short on time now. So the question I was hoping you could address a little bit, it links to the point you made earlier as well, is a question from Kate, who of course appreciate the presentations from all the speakers, as we all. Thank you all for the great presentations. And Kate asked, what is good enough in terms of evidence or data from local voices that we can use to convince donors in one way or another for the need to work better on localization, and for example in an emerging shock situation like this pandemic? And what is it that we can build around that quality of good enough evidence to support us, I think, working toward these objectives within this area of work? So over to you, Mike.
Thanks a lot, Kristen. Yeah, I mean, it's a good question. I think that I think that you know, continuing to try to gather and articulate well in punchy, digestible form evidence of what's working and how it's working through local actors to try to move the dial of donors is quite important, and we continue to need to invest in that. But I think that, you know, I think there's already quite a lot of evidence that has been gathered out there, and it's not just evidence that is the kind of sole arbiter of how donors will act. So I think, you know, different donors face different kind of operating situations and politicians governing them and institutional constraints. So I think one thing is for us to try to sort of identify those donors who are most sympathetic to these approaches and then kind of target them as kind of low-hanging donor fruit. I think we also have to be a little bit patient because, you know, it takes a bit of time to change the way the system works and change the way donors think. I think some of the sort of individual staff at our level within donors can see that this kind of approach approaches working through local actors is important and work and are very sympathetic, but sometimes their leadership, like the top decision makers in their donor ministries, haven't quite cottoned onto that as well yet, and so you know, we need a bit more time and we need a bit more work. I mean, I think, for example, I live in London, and in London, for example, the FCDO, which used to be called DFID, did introduce some localization leaning reforms in its recent tranche of rapid response facility funding for COVID, in terms of insisting that agencies receiving funds give fair overhead costs to local actors, and insisting that agencies receiving funds are transparent about how much of the funding is flowing to local actors, and simplifying reporting requirements. So I think there are pockets of progress. I think another thing is that a lot of donor money is tending now to be dispersed by country donor offices. So one thing we need to do is build strong rapport and relationship with the decision makers at country level in donor offices, because they may be the people that need to be convinced. And I think a lot of donors, because they have money and limited staff, find it easier to write very big checks to very big organizations, including the UN, and then expect, say, the UN to be the channel that delivers money to local actors. So it's also necessary, I think, to advocate and build rapport with the UN as one of the potential key sources of funding. But I think that because COVID, you know, local actors have an obvious comparative advantage in COVID. I think it will over time represent an opportunity to shift the envelope and make greater progress towards the localization aspirations of the grand bargain. But just to ask to kind of briefly, because I know we're short of time, kind of summarize the discussion. I think we were lucky enough to benefit from 4 really instructive and thoughtful speakers. I think Courtney shared with us the really useful and thorough work that Space has done on defining approaches to localization in cash and social protection in COVID, which is a really helpful body of guidance that we can all learn from and try to influence. I think Shiro shared some really interesting operational perspectives from how you know, the learning that Give Directly and its innovative models has come across in trying to put this into practice in real life COVID situations. And then Maureen really helpfully shared with us some of the nitty-gritty challenges that we actually need to face and address in dealing with these issues with communities, and I think really kind of brought home to us the added value that local actors can bring to the jigsaw because of their closer understanding of communities. And then I think Joe also, you know, gave a useful different perspective which pointed to that if we're really going to tackle COVID well, we need to have a strong harmonious partnership between government and civil society and private sector in a joined up whole of society approach. And also gave some really kind of stimulating local examples from India and Mexico and Philippines and Nigeria about what this looks like in practice. And I think also identified that some of the concerns that humanitarian actors tend to have with governments, which make humanitarian actors perhaps less good at engaging with governments than we need to be, include, you know, lack of transparency among some governments in their decision making and in their allocation of funds, and restrictions that some governments are using the opportunity of COVID to impose on civil society space, especially for NGOs working on human rights and protection. And I think it's really good that Joe and his teams are trying to help governments and work with civil society to unblock some of those challenges. So I think, you know, overall we heard really insightful material about the value of local actors in the cash social protection space, their critical link to communities, the contextual understanding and sustainability that they can bring, the fact that they have relationships with government actors that enable them to facilitate access and to engage and to understand how to engage with local stakeholders, their knowledge of the context and communities, the fact that they can therefore move quickly and respond. And I think also the additional value for money that they provide, because I think that local partners can also kind of negotiate transfer rates with local financial service providers to get better deals than international actors are able to get. So I think, you know, there's a lot of evidence out there that our speakers have brought us today about why localization makes sense in the cash social protection space, and there's a lot of important ideas from space about how we can do a better job of making that happen. So I thank all the 4 speakers, because I think they were all really insightful, and it was a really good learning experience.
Thank you, Michael, and thank you all for joining, and also Charlotte and Karine, who were the behind the scenes organizers, and also Space and socialprotection.org for continuing this area of work. And as anyone wants to have anything else to close, or Charlotte, if you need to say anything, I think we will close there. And thank you all for the time. And it was a great session. So thanks very much.
Thanks all.
Thanks, everyone. Bye-bye.